And Dr. Karl's in. Good afternoon, Karl.
Good afternoon, Alex. It's been a while.
It has been a while. Where have you been?
Working, mainly.
Oh, nose to the grindstone.
It has been a little bit like that, yeah. So popping in to see your lovely self at Manx Radio has proved a little bit on the elusive side.
And but now you've spared some time for us, which
my
is very
day
nice.
off.
Is it your day off? I wondered why you were dressed in all the cash. People can see this on the video a little later on if they want to. Dr. Karl in the cash.
Cash.
Yeah,
Is that what it's called now?
No,
Is that what's down with the youth?
Yeah, youth.
I won't even do that because it'll look so bad on video if I do that.
Oh, please do. You can. There we go.
It's quite okay. I'll give that a miss.
I thought you might. Right, we're in to talk, obviously, about everything to do with your pets and to Argbeam, but it's Pet Smile Month.
It is indeed. Yeah.
And now this is a bizarre thing. I've owned many pets over the years, and dog and cats are the sort of key ones.
Yes.
Don't seem to smile very much, but I presume we're talking about their teeth, health in general.
Yeah.
Yes.
Yeah. It fits in with the guest who was just on Women Today. Dentistry, and absolutely they do smile sometimes. It may not look like it, but keeping their teeth nice and white and shiny and clean is really, really important to their health.
Now, how do you do this? Because you and I in the morning get up, clean your teeth with the kids. You can clean the teeth because they understand what you're saying. Dogs and cats, not so much.
The secret is to start young. So if you've got a kitten or a puppy, get them used to you putting a finger in the mouth from a very, very young age. So we either do brushes which literally go on the end of your finger. So you slip it over your finger. It's got like a plasticky brush in the end, and then you don't have to brush earlier on, but just at least get them used to you being in the mouth, and then build from there. Older dogs, if they're not used to it, absolutely they may not let you do it.
I was going to say also, isn't there the first thing, there's a bit of a survival instinct that kicks in with me there about the whole idea of sticking your fingers in a dog's mouth.
Yes, know your pet. You will obviously know how safe it is or isn't to do, and that's the most important thing. And we would never suggest anybody just routinely wander along to the dog, lift up his lip and see what happens by sticking your finger in its mouth. You will know your dog, and whether your dog or your cat will like you doing that. And if you've any doubts whatsoever, don't do it.
Yeah, that's a very good
But
piece of
the other
advice.
side of that is at Argbeam, we're passionate about preventative healthcare, and that's why we will do it for you. So that's why people have regular checkups at the doctor. We live hopefully 60, 70, 80 years. Sadly, our pets don't live that long, so they need more regular checkups because their life moves a bit faster. So we recommend every 6 months. And at a 6-monthly check, the vet or the nurse will always check the teeth and make sure they're okay. And because it is Pet Smile Month, we're doing free checks at the moment. So if you are worried, you want to give us a ring, one of our dental nurses, we've got 2 nurses who've qualified as dental nurses, will look through the teeth. They'll advise you what you need to do. You get a little free pack of goodies to help you, which they'll talk you through, and they'll tell you what we can and can't do about the teeth. Because the important thing is, just like getting them used to you being in the mouth early, is finding the problem early. Because unlike you or I, when we go to the dentist, we lie back in the chair, slightly uncomfortably, it must be said. How do dentists, are they taught to understand that language? Because they always ask questions. They don't keep quiet. They always ask you stuff, don't they?
Yeah.
How does that work? Anyway, our pets don't like that, so we have to knock them out to do it. And it's safe. It's as safe as we can make it. But obviously, the quicker we can make it, the shorter the anaesthetic, the better. And the way we do that is by catching the problem early, and that's by seeing the problem early. And then hopefully, all we've got to do is go in and descale it. So just like your dental hygienist will go in with that was a dreadful sound, wasn't it?
It wasn't the best.
It wasn't the best,
No.
yeah. But I didn't want to frighten her. Some people are frightened by the dentist noises. And we will go in with one of those, and we will descale all the tartar off and clean it up, and then we'll polish it with proper toothpaste that'll clean it all up. And then after that, we will teach you how to keep it clean. And that'll be either, if they will let you, use the brush in the mouth, or there's also things you can add to the water, which helps stop the plaque from building up, soften it a little bit. I think the dentist earlier on was talking about mouthwashes. It's a similar thing. It's a little cup full of liquid that goes in their water, and there's various safe treats that we can use that can help as well. So our nurses will be brilliant at talking people through that.